Hi, this is Terry Hammond. I'm making this video to help anyone who, for whatever reasons, is unable to come back to my rooms. Now, this video is for people who've had a rotator cuff repair. If you have not had a rotator cuff repair, then you'll need to look at another video, the one that talks about people who have not had a repair. But if you've had a rotator cuff repair, you need to watch this video. So, as you know, you'll be in a sling, and it's absolutely vital after a rotator cuff repair that you do not actively lift your arm at all for 6 weeks after surgery. So that active movement is not allowed at all. That's the key thing, the most important thing. You are allowed to do some hand, wrist, and elbow exercises. So I want you to come out of the sling, bend your arm fully down, and bend your elbow fully up, all the way through, full range of motion there, at least a few times every day to keep it from getting stiff. You can move your hand back and forwards like this to keep the elbow from getting stiff as well. You can use your hand, wiggle your fingers like this. You're also allowed to use your hand in the sling. So for normal activities down at waist level, you're fine to do that. If your elbow's by your side, then you can do things down here if your hand's in the sling. So you can do things like type, write, eat your dinner, clean your teeth, those sort of things with your elbow tucked in by your side. So long as you're not lifting your arm, you're absolutely fine. So that is for the first 6 weeks. During that time, you'll have to do a couple of little exercises, one exercise that we call a dead arm hang, and that's to get your arm to hang away from your body. So here's how you do it. So I'll turn around this way. So you get the arm completely relaxed, let it just hang by your side, out of the sling with your arm down like this. And then all you do is just gradually, very slowly, count to about 15 while you do it. Just bend over so your arm hangs just straight down like this. So you just keep going, and keep going. You'll probably need to go to about this level or even a little bit beyond if you can. You could with this hand, just help a little bit, just pushing that hand up like that, just so it hangs straight down. But I don't want you to do any active movement of the arm at all. It just has to hang straight down. So go fully over, take a long time to do it, take about 15-20 seconds to do that, leave it there for a minute or so, and then gradually, I'm doing it a bit faster than you should, so a bit slower than that, gradually back up like this so the arm is then resting by your side again. And then it should go back in the sling. That you should do that fully down like I showed you just then for about 3 times a day. Just take your time, very slow, and again, just hanging down without any active movement at all. Don't do any swinging pendulum type exercises, just that dead arm hang like I said. So that's for the first 6 weeks. Now, during that time, you'll need to take your big bulky dressing. If you've had a big bulky dressing on, that needs to come off after a week. A couple of days. It's probably already off by the time you watch this video. Underneath, you've got some little waterproof dressings. They need to come off after about 2 weeks. You can have a shower while they are on, so you can have a normal everyday shower and get them wet. Don't scrub them, but you're allowed to get them wet, but they should come off fully after 2 weeks, and just leave the skin bare underneath there. So dressings off completely in 2 weeks' time. So after 6 weeks, you can then discard your sling. So that's the time you can then start actively lifting up your arm. So it's very important to know that you can actively move it. You won't be able to move it through a full range of motion by any means at all. It'll be still quite stiff and quite sore, but you are allowed to move it to any position comfortably that you can get to. So I want you to do that for just normal activities like eating your dinner and cleaning your teeth, brushing your hair, and all those sort of things, driving a car. Anything that moves, allows just gentle movement of the arm is fine, but really importantly, no resistance type movements. So anything that involves strength, anything where you're actually lifting or resisting, anything that has force in your shoulder, like lifting a chair or lifting a heavy shopping bags, or anything where you have to tug up and heave up against a resistance, you're not allowed to do. And that restriction has to stay in place for a total of 6 months. Now, I know that sounds like a ridiculously long amount of time, but that's how long it takes to heal. It grows little roots into the bone, and those roots don't get strong for 6 months. So yes, you can move it, but not against any resistance. Let the movement come back by itself over time. Let the strength come back over time. I don't want any strengthening of it. People will incorrectly think they need to get it strong and incorrectly think they need to get movement in it. No, you don't. That'll come back by itself over time. So just let movement and strength come back by itself. First 6 months, very, very careful. We know that people who do the wrong things definitely can tear it apart again. So just to summarize, first 6 weeks, in a sling. Hand, wrist and elbow exercises and gentle dead arm hangs like that, which you do very, very slowly. Do that about 3 times a day. Big main dressing off after a couple of days. Waterproof dressing off after 2 weeks from surgery. Sling off at 6 weeks, then you are allowed to lift it, but not against any resistance, any force. Just take your time. The slower it takes, the better it is, the stronger it'll be. If you have any problems at all, please ring my rooms. We can talk to you, we can guide you through issues. You're certainly welcome to come in at any time. We can go through things again, but sometimes a simple telephone call is all you need to make. You will be worried about 3 months, sort of thinking it hasn't really come along as well as it should have, but don't worry about that. It'll gradually, the movement will come back over time. I can reassure you everything will be fine. Please, as I said, ring me if there's any problems. All the best then.